I'm Marc Alan here on Cash 22. We'll bring in young, up-and-coming professionals and have them mentored right here on the show in a variety of different fields and professions. You were made to do amazing things with your career. So let's get started. Welcome back to Cash 22. We're here again with Ryan Olzack. Ryan, thanks for coming back.
Thank you for having me back.
I'm glad we didn't scare you off.
Yes, you were very calming.
All right, great. And it's an exciting milestone for you. I hear you passed your boards.
Yes, I finally passed the last hurdle that I have before just finishing the last few requirements to actually graduate the university. Wow,
congratulations.
Thank you.
I understand. We spoke a little last time. That's a stressful, tense time when you're studying for those exams.
Yes, very stressful. And this last one was particularly stressful because this is a patient-based exam, so that we have to find patients and then we have to rely on them to show up. And one of my patients actually canceled at 8 p.m. the night before, so that's less than 12 hours before the actual exam started.
So I assume you found someone else?
I found someone half hour after the exam started. A classmate, one of their patients, was willing to come back, and my other patient was willing to come early. So everything worked out, but it was very stressful.
Oh, yeah. Well, congratulations.
Thank
I'm
you.
sure that's a big load off your shoulders.
Yes, it is.
Yeah, great. And we have a special guest here, one of your professors from the dental program, Dr. Dan Edwards. Dan, thanks for coming to the show.
Thank you for having me, Mark.
Yeah, I understand also you're a graduate of the same program that Ryan is about to graduate from?
I am, almost 20 years ago now, 1997 graduate of Michigan.
Oh, great. And what brought you to the program initially? Are you from the area, from Ann Arbor?
I'm from about an hour northeast of Ann Arbor,
Okay.
and I applied to dental schools and interviewed around the country, and figured, in-state tuition with one of the best dental schools in the country. I was definitely accepted that and enjoyed the program. So.
Yeah, that's great. So let's get to know you a little bit, because part of the program today is having you give some mentoring advice to Ryan, but to really understand your background, we'd like to learn more about your career. So since 1997, I imagine you've done some various things in the field of dentistry. What are you doing today, and kind of how did you get there?
Sure. So I graduated in 97, as I spoke of, and I moved to Chicago. I did a postgraduate education program in Chicago for a couple of years. That's optional after dental school. It's just you will receive additional training under faculty. You have co-residents, and kind of makes you feel more comfortable with your skills. And I did that for a few years, moved back to Michigan with my wife. Started in a large private practice as well as an additional small private practice, and I started teaching at the University of Michigan School of Dentistry. And since then, for the last 14 years, I've been teaching and also in private practice.
Okay, great. So teaching and private practice, those must be fairly different parts of your career.
They're very different parts of my career. Growing up, I always considered myself to be a teacher. I had neighborhood kids that would come over, and I was the teacher and they were the students. So my mom kind of teased me that it always was meant to be that I was a teacher. So I enjoy that role. So I enjoy mentoring students, not only in the clinic, but also outside the clinic, and a few of the student groups that are in the dental school. And then I take on a different role in my private practice as running a small business, treating patients, and just doing day-to-day dentistry. So I enjoy the variety to my week.
Oh, that's great. Do you have a favorite part about your job or either of these roles?
I think my favorite part of general dentistry and private practice is I'm my own boss. So running a private practice is like a business, and it can be stressful making business decisions. But ultimately, I know I'm there providing good care for my patients, making them feel comfortable, and having them walk out the door and remarking that was a good experience. And at the same token, teaching at the dental school, I enjoy seeing the progress of the students from when they start as first-year students, when they're assisting, and when they're doing their first fillings and first cleanings and first crowns, all the way up to where Ryan is a few weeks from graduation, where they've progressed so much through the 4 years.
That's great. So did you know Ryan his first year in dental school?
I did. Since we were in the same clinic, assigned to the same clinic, I watched Ryan assist the older dental students, and now Ryan is in that position of being assisted by the younger dental students, and he's a great role model for the younger dental students.
Right. So he's come a long way, I assume.
He's come a long way.
4 years.
He's come a long way.
I hope so.
That's great.
Yes.
So let's take you back to when you were in Ryan's shoes, just graduating from the program. What was going through your mind then? Did you know exactly what you wanted to do, or how did you decide to be a professor part-time, also have your own practice? How did that play out?
So while you're in dental school, you decide whether or not you want to specialize versus doing general dentistry, or in private practice versus teaching. So there are a lot of opportunities after you graduate from dental school. I knew that I wanted to teach at some point, and I was comfortable doing general dentistry. General dentists do the bulk of everything, and you get to pick and choose. So I really enjoyed the aspects of being a general dentist and deciding what I wanted to do and what I wanted to refer out. So doing my postgraduate education residency gave me more training, more background, doing that for a few years, and then deciding, I like this setting, but I think I'm well suited for private practice. So when I joined a couple of different offices, weighing the pros and cons, I thought, teaching would be a good variety to my week as well. So I added teaching. So at one point I was in 2 private practices and teaching at the dental school. I still did have a social life somewhat, but I really enjoyed the variety to my week in teaching and doing hands-on dentistry.
Okay. So with the training that you've done, Ryan, and that you went through as well, is that sufficient to be a teacher, or is there another certification you go through? I'm less familiar with how the program works there.
Sure, yeah. So after graduating from dental school and doing the postgraduate education, I was asked to stay for a few years to teach residents, and so I taught at the residency level. So when I moved back to Michigan, it was kind of a natural transition for me to continue teaching, where I went from a residency teaching program over to the dental school. So yeah, it was slightly different. So there are no specific qualifications to teach. I think to be a good teacher, you need to have a passion for teaching, and I think you have to want to be there. Being a private practice general dentist, I think I bring value to teaching because I bring things that I learn myself hands-on into the clinics with the students, and I let them know, hey, have you tried this? Do you want to think about that? So it's kind of the real-world dentistry versus the academic dentistry. So, and I think the students really pick up on the tips and things that we share from private practice. So that's what I really enjoy, is sharing my failures and sharing my successes with the students so they can put that in their hands and try.
Okay. And Ryan, do you ever have a desire to teach like Dr. Edwards?
Possibly, if where I end up working kind of allows for something like that. One thing that I have always tried to do, like you said, I'm now in the position where I have underclassmen beneath me that are helping assist me during my procedures. I try to always kind of explain what I'm doing and why I'm doing it to them, simply because the faculty isn't there with you 100% of the time. They come in many, many different times to make checks and give you advice and tell you kind of what to change as you're going along. But as far as while you're proceeding with the procedure, say you're fixing a cavity, while you're drilling on the tooth and taking away that diseased tooth structure, he's not sitting next to me saying, okay, yeah, now go that way, okay, now go this way. So I try and do that while the underclassman is helping me so that they can kind of see what I'm doing and why I'm doing it. So I do kind of see myself as a teacher in the sense right now to where I'm there and they can see one-on-one in real time what I'm doing, and I try and explain why I'm doing it. And a lot of the things I end up saying is pretty much what Dr. Edwards told me, a year or so before, and I'm just trying to keep passing it on.
Yeah, I'm actually curious about that relationship. So as you're a professor and Ryan's one of the students in a dental program, would you find that the students graduating adopt the style of the professors uniquely from one place to another?
I think what I see is the students are like sponges, and they absorb everything from full-time faculty, part-time faculty. They take all the different tips and techniques, and they figure out what works best in their hands. There's no right way and wrong way necessarily to do a procedure or a certain technique. I think it's what works in his or her hands. Take it from there and just figuring out what works for you. So I think, yes, it is partly the influences of the faculty that that they have over the students, but as well, I've found in the last 20 years, I learn just about every day, and I have to seek information, continuing education courses that I keep up my license, and reading, and just so much to keep up with, because technology in dentistry is ever evolving. So he has learned a lot, and Ryan's a very good student, but he has a lot to learn. So
what's some advice you have for Ryan in terms of continuing to be cutting edge or leading with the latest technology and information? How can he stay up with everything?
So Ryan is a very motivated student and person, just naturally. So I know he's going to do very well. But just continuing to read and challenge yourself, and just really know that you're doing good things for the patient and taking the patients into your hands and making them feel comfortable and doing your best. We're not always given the perfect scenario or situation, because there are other challenges that patients may have that make things complicated. So just knowing that you do your best and continuing to attend courses, and then part of dentistry, being in healthcare, is giving back. Giving back maybe to the community, giving back to the local area where you practice or where you live. So doing dental health presentations for kids at local schools, or volunteering for what's called a mission of mercy, where patients may not have the being for having dentistry done because they might not have insurance or the means. So.
That's great. So I imagine you've done some of those projects yourself? I
have, yeah. I think volunteering is probably one of my third or fourth jobs, besides being in private practice and being a dad and a husband, and also being a faculty member. I think is being a volunteer, because I strongly believe in giving back to the community.
Do you find a trend when people graduate from dental school, maybe they're focused on getting their sea legs and establishing themselves, and then after a few years they start to want to give back and do more things like that? Is there a cycle like that?
Yeah, I think a lot of dental schools have rotations that the students go out and treat different communities and different groups within the state or within the area, and I think that's a sense of giving back, because they're targeting a certain population that doesn't usually have the opportunity to have dentistry done. So we find our students going out and giving back, if not immediately, because yes, they do need to make some money to pay those high loans off from dental school, but when they have time to fit it in, I think they are very giving, just due to the fact that being a healthcare provider, that's our job, to help people. So.
And that's actually one of my goals, is to always find a time to give something back. And at different different times in my life, rather, it might not be as much as other times. For instance, the first couple of years, I'm going to try and set aside as much of my money as I can to pay off loans, but as finances and things like that settle down, find times to give back, like Dr. Edwards was saying. Before I started dental school, I actually did a mission trip where I went down to Panama and was an assistant to dentists who were volunteering their time for the local population down there, for kids who couldn't see the dentist and things like that. And we did everything from fillings to root canals to extractions. And it was a wonderful experience, and it's something that I hope that wherever I end up working, I can take off time so that I can go back with that group, because I had such a wonderful time.
That must be really rewarding, being able to help like that.
Yeah, it was really a very special time. I'm glad that I did it before I was a dentist, simply because then I could have that experience while I was just sitting there kind of observing, as opposed to trying to see as many patients as I could with the limited time that we had. Because if I remember right, it's been a few years, but I believe we saw 700 kids on 5 clinic days. So I mean, we were busy. I think there was about 15 dentists there.
Oh, wow.
So we were busy.
Yeah, it's probably more patients than you see in a normal office day here.
I'd say so, yes.
Yeah. So Dr. Edwards, you have your own practice now also?
Yeah, so I have my own practice. About 10 years ago, I joined 2 partners, and we formed an office, created an identity and a logo and a philosophy of treating patients, and yeah, so we just celebrated our 10-year anniversary of being open.
Oh, congratulations.
Thank you.
How did you decide who your partners would be? Was that a tough decision?
It was, because they are like my daytime spouses. We make decisions together financially. We do hiring and firing together, which, staffing issues. And so I have 2 great business partners. One was actually a faculty member of mine when I was in dental school, and the other was another faculty member of mine, both part-time faculty members, but also had private practices. So they were talking, and I was talking to them, and we thought, hey, this is going to work out well. We all complemented each other because we all have different strengths and different weaknesses, and so when we were forming our private practice, we thought, this could work. So we started talking about 12 years ago, and like I said, built a practice, and it's up and running and been quite successful.
That's great. I would imagine that a lot of the success of a practice depends on the relationship of the partners. Have you seen practices fall apart because there were tensions in the relationship?
I have. In fact, a friend of mine, a co-resident of mine, who became a dentist, went back to his state and practiced with his dad, thinking that it was the perfect scenario. He's going to take over his dad's practice, and they were going to have that, father-son practice. After about a year, worked out horribly. Oh. And ended up that the son moved out of the practice. So you do have to have that bond, and whether it's a previous bond that you've had or a new bond, you really have to have that relationship and have open communication and make good decisions together, because sometimes things work out and sometimes they don't. So.
Okay. So maybe Ryan knows more than I do, but I'm curious on what the day-to-day life of a dentist is with a private practice, and about how many patients you see every day, and if there are unexpected challenges that come up. Can you tell us a little bit about the daily routine?
Sure. So on any given day that I'm in my private practice, I get there about a half hour before my patients. Usually the practice is up and running. Patients come soon after. I review my schedule with my dental assistant, my chairside assistant, so she knows exactly what we're going to be doing from patient to patient. So because we're a team, chairside, and that is also another relationship that needs to be strong, because patients can sense whether or not a dentist and a dental assistant are working well together or not. So yeah, my typical morning is seeing patients for about 3 or 4 hours, having a lunch, and then 3 or 4 hours after lunch, continuing to see patients. So patient appointments are typically about an hour, could be as short as a half hour if it's an emergency patient that I'm trying to squeeze in, could be an hour and a half to 2 hour appointment if I'm doing extensive treatment. So, and along with my chair that I'm running with my assistant, I'm also checking the hygienist with their patients. where I pop in for 5 minutes, check that patient, address any issues or concerns that that patient has or the hygienist has, and then return to my patient. So it's a fine balance of time management where you are going from room to room and trying to allow the patient that you're working on feel like they're the only one there in the office. So there is, and then accepting the phone call when the specialist calls and says, "I have your patient in the chair, and they want to talk about something," or the dental rep stops by that wants to showcase their new composite or new crown that they have. So it's quite a busy day and challenging, and but keeps me on my toes.
Oh, right. What advice do you have for Ryan in terms of deciding how to balance all of that? How much time should he focus on developing those relationships with the hygienist versus just looking at the patient? I mean, have you learned a few things along the way that maybe you said, oh, I should have spent more time with the patients up front? Any takeaways you can share with Ryan on that?
Yeah, so I would say that, again, having good relationships with your hygienist and assistants and front desk, because those are the employees that are with the patients and chairside with the patients, and they're a reflection on your practice. So the very first impression of a patient has of your practice is when they call on the phone and speak with your front desk person. So you need to have the best people up there at the front desk that are welcoming and can answer patients' questions and make them feel comfortable, like it's a good fit for them. And then when the patient comes into the practice, making sure that the patient is welcomed properly, and then trying to run on time, obviously. So having good employees and good staff that manage their time well so that the office flows and runs well. And then having staff that communicate. So the front desk staff communicating with the chairside assistants and also the hygienist, and making sure that everybody's communicating in what the day brings, as far as patients may be running late, patients may be canceling. So can you think of somebody that fills that time slot? And so just having open communication with your staff, and then open communication all with each other.
Now, one question I have as far as how do you find possible candidates for these positions? Say you're opening up a brand new practice in an area that you don't really know. I mean, what are you actually looking for as far as like for an interview with a potential hygienist or a potential chairside assistant or a potential front desk, to where you kind of can tell during the interview whether or not she would, or he or she would fit in with what you're going for in that office?
So I'll give you one example that we've had in our practice, hiring, say, a hygienist that have 20 years of experience. You know that hygienist is probably pretty good with patients due to the experience that he or she has had. So we've hired a hygienist with 20 years of experience, and she's working out great. She's people person, great skills, just kind of fits into the practice really well. At the same time, we've hired a hygienist that was fresh out of school. And so that hygienist obviously doesn't have as much experience. However, she was really great with the patients right off the bat. Her skills were being honed as the years...
Hopefully mine will be.
Correct, yeah, as the years went on. So I guess I wouldn't necessarily base hiring staff from experience alone, because I think it just needs to be a good fit for your practice. And how you find that hygienist, that's the million-dollar question, right? So you can look at ads, online, offline, word of mouth, so communicating with your colleagues in the community that they may know of a hygienist or an assistant or a staff member that is looking for a position, bringing that candidate in, interviewing, and just making sure, again, that they have a good practice, good grounds for practice philosophies that kind of match with your own. And what we've said to our hiring staff is take a look at our website. Our website is actually a reflection of us and our practice. And if it seems like it would be a good fit for you, let's schedule an interview.
Okay. Have you ever done any sort of like a working interview to where you have them see a patient or two before you officially hire them to kind of see for yourself how they interact before you actually pull the trigger, I guess?
So that's another good question. I actually myself went through a working interview. When I came back from Chicago, moved to Michigan. I was hired by a practice, and I was given 1 week of chairside sit down with patients, working interview. And at the end of the week, I was evaluated, and thankfully I was granted the job. But I was being evaluated by the dental assistants, by the dental hygienist, by my thoroughness, by my patient interaction, and the dentist that hired me really wanted to know that I would fit well into their practice. So at the same time, we don't do working interviews in my office. However, we do a 90-day review. How is it working? Is this practice comfortable for you? Are you getting along with the patients well? Do you like the patient flow? Do you like how things are running? So we do do a 90-day review that allows both parties to give input and say whether or not it's working.
That's nice.
So
It sounds like the dental hygienists are a little bit hard to come by. Is that correct? Would you say there's a shortage in the market for good hygienists?
I would say that it might be equally as challenging finding hygienists, assistants, and front desk.
Okay.
It seems like with any industry, when it rains, it pours. I may have 5 hygienist resumes pass through my office in a month or 2 period who are looking, and I may go 6 months without hearing anything from a hygienist. So I would say not necessarily a shortage, but I will say with the economy 7-8 years ago being more in a recession, you saw a lot of hygienists that were retired going back into the field. So you found that the hygiene jobs were a little less because of the return of a lot of hygienists that needed to work again. So, and probably the same with assistants and front desk.
Right. Okay. What's your thought on the outlook for dentists in general? Is there a big demand in the country for more dentists? Or if somebody's considering going into this field, would you recommend that there are many jobs available for dentists right now graduating?
I would say that there are going to be a number of jobs. The baby boomers are getting ready to retire soon, and I think a lot of private practices are going to be sold. There's always a faculty shortage in dental schools, so there seems to be quite a few openings in the teaching arena. But I think the dental field is pretty bright. I think that there are going to be a lot of opportunities. I think that the opportunities that are out there, again, are going to have to be a good fit for that individual. So whether it be a small practice, a group practice, is it a practice owned by a dentist? Is it a practice that's larger that might be owned by a company? So I think the jobs are there. I think that, again, with dental students coming out in a higher debt situation, they're eager to work and make money. So hopefully there will be something there for them.
Yeah, great. And you mentioned you have a family also, correct?
I do. My wife and I met at Michigan before I went to dental school, but we started dating while we lived in Chicago. She lived there as well. And then, I have 2 boys that are 8 and 11.
Oh, that's amazing. And do you have any advice for Ryan on maintaining a happy marriage and family life while being a dentist? Any pointers there?
Yeah, so, wow, that's a good question. Again, I think, having a good practice and being happy in your career, I think translates in having an easier marriage, because you come home happy, and yes, there are the day-to-day challenges and stresses. However, it is great to come home to my wife and my boys, and my wife works as well. So she has a career, and my boy's obviously in school. So everybody's busy, but at the end of the day, we try to spend as much time together as well as on weekends. And even though my wife and I are pulled in different directions with volunteering and with our church and with our boys' activities, I think having open communication again and having a strong marriage in that sense, I think is essential. So
now, have you found that having partners in your dental practice has kind of helped with some of the day-to-day stress of managing a dental office?
So that's a great question, because the most stressful part of my day is the business aspect of dentistry. I can do fillings, I can do crowns, I can do that. That's no problem. It's the managing the day-to-day business. So the thing that I like about having partners is that we distribute those responsibilities between the three of us. So I have a niche in our practice that I take care of certain things within our practice business-wise. My other two partners have their niches. So the three of us act as office managers. We have no office manager. The three of us work together as the office manager. So yes, it definitely helps take the stress and the load and pressures off when you have business partners. And that's what I enjoy about a group practice, is that it's not just me, it's my partners in business that help as well.
Great. Well, we're going to wrap things up, and I learned a lot. I hope you learned some things
Definitely
too,
did.
Ryan. And I also encourage you to continue the mentoring relationship. It sounds like you already have a strong relationship from school, but I think that would be something very valuable for you moving forward, Ryan.
Absolutely.
So I hope that will work with you, Dr. Edwards, too.
Absolutely.
Great.
Absolutely.
And thanks so much for being on the program. I really enjoyed getting to know each of you. And I think the viewers learned a lot about what it's like to be a dentist and go through the whole process. So I really appreciate that. Thanks again. This is Marc Alan, and this is Cash 22.
Somebody tell me I'm in need of a woman like you.